We're talking about varicose veins, and there's several ways that you can get rid of those and those spider veins this summer. So in today's house call, non-invasive treatments. Dr. Brent Greenberg is a phlebotomist with the Carolina Vein and Laser Specialist, just a varicose vein specialist.
That's correct.
Is
That's
the best
correct.
way to say it. He's a member of the Cone Health medical staff as well, and he's going to talk about really how we can find out if we're, first of all, eligible for the non-invasive treatments,
Right.
and secondly, there's so many different ones out there, right?
There are several options, and fortunately what's really amazing now about varicose vein treatments is that you don't have to go through a hospitalized procedure any longer to undergo an excellent result. It used to be up until about the year 2000, we had to have what was called vein stripping, and when people hear about vein stripping, it's the first reason why people won't come to see a vein specialist. But in the last decade, we have been amazing results now with office-based procedures that require no downtime from work. You can be done under local anesthesia, so you don't have to be asleep for any of it, and you can go right back to your normal day activities. And we expect people to be active after treatments, because the more active they are, the quicker they respond to the result and the faster they heal.
We have come a long way, haven't we?
We have come a huge way.
All right, let's talk about the different procedures. First of all, you have to have the type that you can have with a competent valve. Does that make sense?
Well, initially what happens is with veins, they have what are called valves, which hold blood in place. And
Okay.
normally the job of those veins is to move the blood out of the legs back up to the heart to recirculate. But sometimes what happens is these valves go bad, and as was discussed on Monday, valves that go bad result typically from genetics, where it usually runs in families.
Right.
But it also occurs with people who have the kinds of jobs where they stand or they sit for prolonged periods, like news anchors or nurses or teachers. It occurs with people who have had multiple pregnancies or injury to their legs. So as a result, these valves go bad, the blood starts to move downward. That creates pressure, which results in the formation of these bulgier veins on the surface. And that's what will cause all the soreness and the bulging varicosities. And eventually, the fluid inside the veins will shift, causing swelling in the ankles, aching, heaviness, and a large percentage of people have nighttime symptoms like cramping or restlessness to their legs. And typically people will say they feel better when they're active, running or exercising, but feel worse if they stand or sit for prolonged periods.
And that makes sense. Makes a lot of sense. So, well, the first one we saw was a competent vein. This
Right.
is an incompetent vein. Now, let's talk about the procedure.
So in the old days, we talked about a hospital-based procedure called vein stripping. What we do nowadays, we numb an area in the skin, and we place a small, tiny fiber inside the vein, and then that fiber will be energized at the very tip. We numb around the vein so that you can be awake during the procedure, and as we numb it, it surrounds that vein, and then we energize the tip of the fiber, and as we slowly pull it out, the energy will seal the vein shut from the inside. That shuts off the pressure coming down that valve. And one of the most common questions people ask me is, don't I need this vein? If I close it, how does the blood drain out? Well, for every bad vein you have, there's 1,000 other veins that pick up the slack of this vein. And these other veins have much more efficiency now that they don't have to pick up the stress of this abnormal vessel.
And then you have something called sclerotherapy?
Right. Now, in many cases, once you shut off the pressure source of the main vein, you will still have the residual varicose veins and veins that connect off this abnormal large vein to those varicose veins. And so what we do is we take medicine and inject it into those residual vessels. That causes the lining of the veins to come down, and the veins will contract, and the body will break them up and reabsorb them over time. Again, that's an outpatient procedure. It's minimally invasive, and you can go back to work and act and do all your activities.
And the good news is, a lot of times, most of this is covered by insurance, because if you have those leaky valves, it is an indication there could be a problem.
That's correct. And actually, insurance loves these new procedures now because you don't have to do it in the hospital, so it's much more cost effective, and people don't lose work time, so they can go back to work, and so they get much better results. You know, the vein procedures, the old ones had as much as a 40% failure rate. Nowadays, the new vein procedures, these laser procedures, have as efficacy, which means the quality of the procedure works more than 95% of the time, and that's practices all over the world. So it's got enough history, and it's done all over the country now, where it's excellent results.
Great. Thank you so much for joining us.
I appreciate it.
Very enlightening. On Friday, we're going to talk about some non-invasive treatment options for spider veins. So, Brad, you're going to listen for that one.